Hello, students. Let us now talk about one of the most important pillars of community and public health nursing, the maternal, child, and adolescent health services. This topic covers how nurses promote health and prevent illness throughout these life stages, from pregnancy, infancy, childhood, to adolescence. We will look into how these services support national and global health goals, particularly in achieving the Sustainable Development Goal number 3, which focuses on ensuring healthy lives and promoting well being for all ages. This area of community health focuses on the health of mothers, infants, children, and adolescents. These are the foundation of any healthy society. Its purpose is to promote wellness and prevent illness across life stages. This means interventions start before birth, continue after delivery, and progress through childhood and adolescence. This program also aligns with SDG 3, which is good health and well being, emphasizing universal access to essential health services, reducing mortality, and stronger community health systems. In the Philippine context, these priorities are part of the Department of Health's national agenda for family health. Now, why is maternal, child, and adolescent health so important? First, it is a public health priority. Mothers and children are among the most vulnerable populations. Their health reflects the overall well being of a community. High maternal and infant mortality often indicates weakness and weaknesses in the health system. Second, healthy mothers and children build strong, productive communities. When families are healthy, they contribute to economic growth and social stability. And third, nurses play a key role. We provide family centered and preventive care by conducting prenatal visits, immunizations, and health teaching. We also act as advocates to ensure access to equitable, quality services to all. The goals of maternal, child, and adolescent health programs revolve around these three main priorities. One, reducing maternal, neonatal, and child morbidity and mortality. This means decreasing the number of women and children who die or become ill due to preventable causes. Ensuring access to essential quality and equitable health services. No matter where families live, be it in urban and rural areas, they should receive the same standard of care. And promoting healthy growth, development, and responsible adolescence. Nurses encourage not only physical wellness, but also emotional and social development, especially among the youth. These goals mirror the country's universal health care or RA 11223 and the Department of Health's Healthy Pilipinas campaign. Maternal health includes prenatal, delivery, and postnatal care. Prenatal or antenatal care ensures that the mother's health and the baby's development are monitored. Safe delivery practices and postpartum support reduce complications. For newborn and infant health, this focuses on areas such as immediate newborn care, immunization, and proper nutrition. Immediate newborn care follows the EINC protocol or the Essential Intrapartum and Newborn Care Protocol. This ensures skin to skin contact, delayed cord clamping, and early breastfeeding. Nurses play a major role in ensuring these services reach every household through home visits and coordination with lying ins and midwives. Child health focuses on growth monitoring, early detection of illness, and health education. Regular weight checks, immunizations, and developmental screenings allow early intervention. For adolescents, the emphasis is on reproductive health, mental health, and life skills program. The goal is to guide the youth in making responsible choices, preventing early pregnancy, substance abuse, and risky behavior. These services empower families and youth to take charge of their own health. The Department of Health implements several flagship programs under the Family Health Cluster. This includes the Expanded Program on Immunization, or the EPI. This provides vaccines against preventable childhood diseases like tuberculosis, measles, and polio. The Newborn Screening Program, as stipulated in Republic Act 9288, is important in detecting congenital disorders early on to prevent complications and lifelong consequences. The Universal Newborn Hearing Screening under RA 9709 is for identifying hearing impairments as early as possible to support learning and communication. These life saving initiatives that nurses implement directly in the community setting are important in ensuring a healthy child. Other key national programs under the Department of Health includes the EINC, or the Essential Intrapartum and Newborn Care, the Unang Yakap Initiative, ensuring proper care during and after birth. There is also the Adolescent Health and Development Program, or AHDP, promoting adolescent friendly services, sexuality education, and counseling. All these programs are integrated under the Family Health Cluster of the Department of Health, emphasizing continuity of care from pregnancy to adolescence. Integration ensures efficiency, avoids duplication of services, and maximizes health outcomes. The continuum of care framework captures the concept of from womb to adolescence. It recognizes that health is continuous and interdependent across life stages. It emphasizes integrated services, meaning maternal, newborn, child, and adolescent care should not exist alone and separately, but be connected through home, community, and health facilities. By maintaining this continuum, nurses help prevent service gaps. This ensures that no mother or child is left behind due to poor coordination or follow up. Community health nurses are the backbone of these programs. As care providers, we deliver direct services such as prenatal care, immunization, and postnatal follow ups. We act as educators, conducting health teaching on breastfeeding, nutrition, and hygiene. And as advocates, we raise awareness about women's and children's rights to quality care. Home visits are crucial. We conduct prenatal and postnatal monitoring during home visits, perform growth assessments, and provide counseling and referrals when needed. For adolescents, our role expands into health education and counseling, covering topics like reproductive health, mental well being, and substance abuse prevention. We also serve as coordinators, linking barangay health workers, midwives, and local leaders to organize outreach clinics and health campaigns. Through these roles, we embody the principles of primary health care, such as accessibility, community participation, and intersectoral collaboration. Maternal, child, and adolescent health programs are guided by both global and national frameworks. Globally, the World Health Organization's maternal, newborn, child, and adolescent health strategy provides direction for improving health systems and reducing preventable deaths. Nationally, the Philippine Universal Healthcare Act, or RA 11223, ensures that all Filipinos can access comprehensive health services, from preventive to curative care, without financial hardships. In alignment with the Sustainable Development Goals, particularly SGD 3 Target 1 and 2, the country aims to reduce maternal mortality to less than 70 per 100,000 live births and to end preventable deaths of newborns and children under 5 years of age. The DOH advances these goals through initiatives like Healthy Pilipinas and Kalusugan ng Magnanay program, which emphasize health promotion, family-centered care, and equitable access to services. Despite progress, challenges still persist. One is the rising concerns that include maternal deaths and increasing adolescent pregnancies. These issues are often linked to poverty and limited access to reproductive health education. Access gaps remain, specifically in unserved and underserved areas where facilities and manpower are scarce. And finally, community needs. We still need to strengthen health literacy and participation. Many families remain unaware of the services available to them. Nurses can bridge these gaps by empowering communities through education, collaboration, and compassionate care. To summarize, maternal health And child health and adolescent health is central to community health nursing practice. Preventive care, early intervention, and continuous family engagement save lives and promote equity. As community health nurses, we are not just care providers. We are advocates, educators, and agents of change who bring these programs closer to the people who need them most. Remember, when we safeguard mothers, children, and the youth, we secure the future of our nation.